Senator Bernie Sanders took questions for the first time since his heart attack last week. The 2020 Democratic presidential candidate spent 3 days in a Las Vegas hospital. Doctors found a blockage in one of his arteries and inserted 2 stents. He was released on Friday. Speaking at his Burlington, Vermont home, Sanders said he would release his medical documents at the appropriate time. He also gave his perspective on the experience.
I must confess that I was dumb. I was born, and thank God that I have a lot of energy. And, you know, during this campaign, I've been doing, in some cases, 3 or 4 rallies a day, running all over the state, Iowa, New Hampshire, wherever. And yet I, in the last month or 2, just was more fatigued than I usually have been. So, and I should have listened to those symptoms. So if there's any message that I hope we can get out there, is that I want people to pay attention to their symptoms. And, you know, when you're hurting, when you're fatigued, when you have a pain in your chest, listen to it.
Let's bring in Eliza Collins in Washington and Zach Hudak in Boston. Eliza is a politics reporter for the Wall Street Journal. Zach covers Elizabeth Warren's campaign for CBS News. Welcome to both of you. Eliza, I'd like to start with you. What did you take away from Senator Sanders' comments?
Well, Sanders is trying to flip the narrative on this. He's trying to make this essentially a public service announcement. You know, look for symptoms, pay attention to your body, go to your doctor. And we have seen him talk about this in access to health care. Sanders is pushing for a government-run Medicare for All system. And he's basically saying, I had a heart attack. I wasn't paying attention to my body, but I was lucky because I had access to health care and they were able to help me, you know, give me the stents and get him running again. But he said not everyone has access to that. And so he's actually using this as sort of a campaign, you know, policy proposal. And so they're really just trying to flip the narrative and say, look, he's healthy, but he's being reflective.
Eliza, is it clear why the Sanders campaign has not been more transparent about his health issues?
It's not clear. I mean, I imagine if you're a political campaign, you don't want the word heart attack out there. Sanders is 78 years old. He's the oldest candidate in the race. You know, the top 3 candidates are all 70 and above, and the president is 73. But you want your candidate to be seen as healthy, as vital. Sanders does. He talked a little bit about his aggressive campaign schedule. I spent a lot of time out with him on the road. He does keep one, and they've been able to hold that narrative. But if you go out and you say, you know, he had a heart attack, it brings the conversation of age back up. It's just a conversation they don't want to have, which is, I think, why they're flipping it to be about policy, Medicare for all, listening to your symptoms.